How do we actually do this? We know where the air goes. We know it comes in through our nose, down through our pharynx, trachea, bronchi, bronchioles, alveoli, and reverse. The CO2 filled air is going to come back out. Alveoli, bronchioles, bronchi, trachea, pharynx, nose or mouth. But how do we actually do it? Well, I alluded earlier that we've got to use our diaphragm. So inhalation, or the actual breathing in of air, occurs when your diaphragm moves down. So we said our diaphragm was kind of this dome shape. So when you inhale, that diaphragm moves down and becomes more flat. That increases the space in your chest cavity or in your thorax. When we increase that space in your chest cavity without changing anything else, the pressure around your lungs will actually go down. So increased space equals decreased pressure. When the pressure goes down, we look at air moving down a pressure gradient. Okay, this is something known as negative pressure breathing. So now the pressure inside your lungs is less than the pressure outside in the room. So the outside air wants to move into your lungs, and it does so very, very easily. Diaphragm moves down, lungs inflate. Why? Because as the diaphragm moves down, it increases the space in the thorax, which decreases the pressure. And if the pressure in is less than the pressure out, air moves in. To exhale, we do the opposite. The diaphragm relaxes and pushes upwards. When it does that, it increases the pressure inside. Why does it increase the pressure inside? Because you've decreased the space in the thorax. If you decrease space, you increase pressure. And when you increase pressure inside, now the pressure in is greater than the pressure out. Air wants to move out. And you exhale. That's really all there is to it. Now, for most students, this is difficult because you have to keep track of what is going on as far as the movement of the diaphragm. So you exhale, or air out. When we look at the diaphragm going from this to this. Now, yes, this is extreme. Yours doesn't move quite this much. But when this occurs, when that diaphragm moves up, we actually look at the pressure in the thorax goes up. Why? Your lungs are full of air. Imagine this. Your lungs are full of air. Your diaphragm now pushes up against your lungs. So it's like squeezing your lungs, right? So it increases the pressure. If you increase the pressure, air moves out. Because the pressure in the thorax is greater than the pressure in the room. Air moves out. You're going to have to think through this a couple of times. Which way is the diaphragm moving? What is going on? How does the diaphragm actually move? When we look at the diaphragm actually moving, when we look at this downward motion of the diaphragm muscle itself, remember this is muscle. The diaphragm muscle itself is actually contracting. When a muscle contracts, it gets shorter. So if the muscles are getting shorter, they're pulling this down. When it pulls this down, the pressure inside the chest cavity goes down. When the pressure inside the chest cavity goes down, pressure is higher outside than inside, air rushes in. When the diaphragm relaxes, when those muscles relax, everything goes back to its resting state, which in this case are very long muscles, very long, that are actually going to squeeze the lungs when they do this. And when they squeeze the lungs, the pressure is greater inside than in the room. If you're squeezing your lungs, air moves out. We do look at the fact that we do not breathe out all the air in our lungs. If you do, you're dead. The reason? Because we have what we actually call dead air inside your lungs. This is air that's going to stay inside your trachea and alveoli and all of the bronchioles and bronchi. Because if you expelled or exhaled all the air in your lungs would actually collapse. So we have to look at the idea that when you take in air from the atmosphere or from the room, we see that air mixing with the dead air or that CO2 rich air that's already in your lungs. This is okay. You're getting enough oxygen in under normal conditions that this will be just fine. This will work just fine for you. We do see that breathing for you is essentially automatic, right? You don't sit here and think, breathe in, breathe out, breathe in, breathe out. You couldn't do anything else with your day if you sat around thinking like that. So you actually have breathing control centers in your brain that don't respond to O2 levels. They actually respond to carbon dioxide or CO2 levels, particularly in your blood. And what they're looking for is a change in blood pH. Because when your CO2 levels increase, when CO2 in your blood goes up, the pH of your blood goes down. Remember, down is acidic. So to counter this, your brain says, hey, stupid, breathe. And you start breathing. As you breathe, the CO2 levels go down, the pH in the blood goes back up, and everything goes back to normal. Over the course of your day, you are constantly correcting for this. So your brain is constantly monitoring the pH of the blood. That constant monitoring will trigger you to breathe more or to breathe less. Now, at night when you're sleeping, when you're at complete rest, your breathing rate slows dramatically. And the reason that it slows so dramatically is you've actually stopped doing some of the major cell things you do during the day. You're not moving around, right? You're doing basically vital organ function maintenance, and that's it. So you're actually producing lower CO2 levels. If you produce lower CO2 levels, if your carbon dioxide levels are low, you can actually slow your breathing because you don't need to exchange as often. You're getting plenty of oxygen into your cells to do what they need to do. The regulation of this breathing will also be controlled by nervous signals. Because what you will see when we talk muscular system and skeletal system is in order to contract those diaphragm muscles and to contract those rib muscles, to get air to move in, we actually have to use nervous signal to do it, of course.